Hello everyone, Winell Belfonte of CohnReznick here at our Affordable Housing Conference in Las Vegas. We just wrapped up our panel on prioritizing and balancing community development needs as it relates to healthcare. And I'm here with my lovely panel, Norris from National Church Residents, Ali Solis of Make Room USA, and Meg Manley of McCormack Baron. So ladies, thank you so much for such a rich and robust discussion. I think the audience had great information from you guys and was able to take some really good nuggets back into their development opportunities, activities, and teams. And if you can, just succinctly give us one nugget or takeaway that you had from our conversation.
Yes. Okay, so we just had a quick consensus. Okay, so I'm Meg Manley of McCormack Baron. We sort of had three takeaways. What I want folks to focus on coming out of this is that there's a tremendous amount of low-hanging fruit, issues that can be attacked immediately by the development community. If it comes from site selection, choosing sites that are well-linked to services and support, mixed income communities. You cannot believe the impact that having a mix of incomes creates on the health of a community, the overall health, by not just putting people of lower income all in one place. The services that we connect people to, many of which are free, they are available. Reaching out to foundations to help fund services to the residents so that we can have ongoing active programming. Another idea that we've started implementing is adding a full-time supportive services person, doesn't have to be a social worker, to your operating budget so that we know that role is being fulfilled on a daily basis for our residents. And so there's so much that we covered, but I'm just sort of going to wrap it in that little wrapper. But there is so much that we can do that I think doesn't even cost a lot of money. But please do reach out to foundations about services, because I think that they will really appreciate the connection to housing and healthcare, and especially with the national dialogue that's going on right now. And foundations are very interested in investing in things that are going to help fulfill the national crises that we see.
I'm going to just say that, first of all, I'm so excited that this conference was going on. I think it's just a great thing, and we need to have more of these conferences and more of these dialogues in order to continue to move forward the conversation that is happening and will not stop, and that is that healthcare and housing need to work together. It's a changed world, it's a changed future, it's an exciting future. At National Church Residences, since much of our focus is around the senior space, the thing that we see that I will challenge people to think about is that why we're talking about it as developers and operators and owners, the other place it's getting talked about is between the state offices of Medicaid and housing. And they are talking about this as ways to create cohesive and creative models. And we want to be the people that step up and help them find solutions. So we're very excited about being here. Thank you.
And I'm Ali Solis with Make Room, and our job at Make Room is to really unhide the human suffering that's happening behind closed doors and share the stories, both the success and the struggles of families that are struggling to find a home that is affordable and therefore really having tragic health outcomes often. Both short-term and then long-term, we're trying to create a society that is a thriving one. And so what does that mean from a public policy standpoint and from a partnership standpoint? We spent a lot of time talking about that today. I think we've got a lot of really innovative solutions that are already on the ground and working. We need to find ways to lift those up. And so one of the outcomes that we talked about was developing kind of a practitioner working group that looks at providing solutions to state policy leaders, whether they're the housing finance agencies or Medicare agencies, working with the political leadership teams there to help them connect the dots, and then at the federal level, bringing in a group that can connect with policymakers within the Congress, but also work within the administration, who is thinking about this so that we can provide solutions and recommendations on policy changes that make these programs more efficient and effective. And the last piece I'll close with is just always kind of reminding ourselves that at the end of the day, this is about people. And so how do we empower those residents to share their stories? At Make Room, we're working with partners all across the country, like my friends here, to find ways to share those stories. And so that'll be a connection point going forward. CohnReznick has been a great partner in doing that, and we're looking forward to continuing to work on this important intersection between housing and healthcare.
Thank you, ladies. Very well said. And we're happy to have coordinated this effort and this conference and really bring to light a lot of awareness around the intersection of housing and healthcare. Thank you.
Thank you.